Okay, so welcome to today's webinar on community health worker training. It's going to be held in Tillamook, Oregon. I'm Paul Matano, Program Manager with Professional and Continuing Education, and I'm here with Ann Custer from the College of Public Health and Human Sciences at Oregon State University. So a few housekeeping items before we get started. This session is being recorded and will be available for viewing within 24 hours. You can expect an email from PACE with the recording link. You can feel free to chime in with questions. We're actually going to ask for any questions at the beginning. If you have any throughout the presentation, you can feel free to chat those to us via the questions box. If you want to actually ask a question in person, I can unmute you and you can ask the question directly to everybody. So however you're comfortable doing that, feel free. And we do encourage as many questions as possible. People get a lot out of these webinars, the more interactive that they are. So a little bit about Oregon State's PACE. Professional and Continuing Education engages the community through educational opportunities for both personal enrichment and professional development. So we do offer hundreds of courses and certificate programs that are open to the public, and these offer tangible value through quality programming. And we address educational, professional, and economic development goals for you or your organization. Partnerships provide amazing opportunities for professional and continuing education that can advance careers, foster personal development, and directly benefit communities of all shapes and sizes. And PACE is committed to bringing the best of Oregon State University to people of all ages and industries, and we are very proud to be working with Ann on doing just that with this community health worker program. So real briefly, our agenda for today, I'm going to be introducing Ann Custer, and we're going to I'm going to prime you now, so if you do have any questions coming into this webinar, maybe think about what it is that you want to get out of this webinar and what information you're really hoping to. Feel free to just chat those, like I said, either at the beginning or throughout as well. Ann is going to present on the Community Health Worker Program and the Tillamook training that's coming up and talk about some of the program benefits. And we're going to have a question and answer session throughout and at the end. And then at the end of the webinar, there's going to be information on how to contact PACE if you have any additional questions, and also how to register for the program. So without further ado, I would like to introduce Ann. She's our webinar guest and the instructor for this class. So Ann supports OSU's College of Public Health and Human Sciences in building capacity of the current and future public health and human sciences workforce to meet the needs of individuals, families, and communities. Her work focuses on managing a portfolio of professional development offerings related to public health and human sciences and involves collaboration with a variety of internal and external partners, including faculty, industry, and governmental agencies. Broadly speaking, her professional interests involve collaborative partnerships and innovative programming to improve population and individual health, with particular emphasis on facilitating linkages between academia and industry, research, and practice. Additional and related interests do include workforce development and healthy aging. Ann, and I think you had wanted to maybe have people introduce themselves that are online. Is that?
That would be lovely. It'd be nice to know who is on the line, where you're from, and perhaps a little bit about your interest in the webinar.
Perfect. So I'm going to unmute you guys, so and I'll just go down the list. So I'll just call people out. That might be the easiest way. So Amy, do you mind introducing yourself first? Hi, Amy. I'm not sure if her audio's on. We'll come back. Oh, looks like Amy Young is here from OSU Outreach and Engagement. So thank you, Amy. And Blanca? I'm not sure if people are able to speak, Ann, so I don't know. If people want to just sort of chat where you guys are from, and I can sort of start reading them out as they get here. Ann, is there anything that you wanted to add in terms of your intro or sort of your background on this?
No, actually, as you were reading some of the things, I forgot about a few things, so thank you for reminding me. But one thing, just to make sure folks know then how to chat. I'm just wondering, in case someone hasn't been on a webinar before, just maybe make sure that you see where that type message here, there you can go ahead and type straight into the computer if you don't have your audio working, or prefer to chat. Just make sure you know how to do that.
Perfect. Yeah, so it looks like people are chatting in. So we have Emily Banjoy is here from Tillamook County Women's Resource Center. She's a health programs coordinator. Erin, she is the executive director at CARE in Tillamook, and they're interested in seeing if this training would be helpful for staff. So that's good.
And I'm sorry, where was that from again? I'm not seeing the, where was?
The executive director at CARE in Tillamook.
CARE, thank you.
And we have Jessica. Hi, Jessica. She's here from OSU Extension for Family and Community Health for Tillamook and Lincoln County. And Michelle is here from Tillamook County Year of Wellness. She's the coordinator, and she is listening in to learn more about community health workers in general and the upcoming training. And we have Grace, who is with OSU Extension and Tillamook SNAP Ed Education Program Assistant. And Blanca is from OHSU in Scappoose. So, yeah, keep it coming. Thanks, guys.
Scappoose. I used to work with someone in Scappoose. I've never been there before, but I hear it's a beautiful place.
I haven't been either. All right, so, yeah, Blanca says it's very pretty, so I think we're going to have to go check it out.
Okay.
Right, so we're going to go ahead and get started. So this is the community health worker training, and Anne, I'll let you take it away from here.
Absolutely, and thank you so much for the introduction there, Paula, and for being the slide maneuverer. So you could go ahead to the next slide, please. I prepared a few slides here to talk a little bit about community health workers and a little bit about the community health worker training program. But again, want to make sure that we're here to answer your questions and meet your needs. So do continue to put in the chat if you have specific questions, either while I'm going through this presentation or for afterwards. And do know, Paula, that I can't see that chat. And so I'm relying on you to keep me posted, okay?
I can do that, and as questions come in, I'll just insert them. Okay.
Wonderful, thank you so much. All right, so if you look at the overview of what is it that a community health worker does, they basically, the bottom line, that 5-minute elevator speech first line, is that they serve as a bridge. A community health worker serves as a bridge between the group of folks on the right side of this picture and the group of those folks on the left side of this picture. So between the communities and the families within those communities and the individuals within those families on the one side, and the health and social service systems on the other. I really like this visual. I like to make sure that everyone has a good understanding of this, because sometimes people might be familiar with a community health worker that's worked in a specific role. Say they've worked in a healthcare system, and they oftentimes see those services that they can provide to communities and families and individuals, but they don't realize that their role is from a broad perspective, it's just as important that they're also providing great insight back to the health and social service systems. So one of the unique things about a community health worker is that they are either from the community that they serve and deeply embedded in that community, or in some other way have great knowledge of that community. So they're well trusted by the community and the families and the individuals there. And in addition to helping the people there to be able to access and interpret and receive and benefit from the services provided by healthcare and social service systems, they are also there to help the health and social service systems understand their communities better, what their needs are, what their wants are, what their strengths are, what it is that they want both as communities and individuals in the community. So that's the visual I would like to present, broadly speaking. Next slide, please, Paula. Here is a definition, and yes, I know you're not supposed to put more than 7 lines on a slide, so this makes it really tiny, but I I do think this is one of many, but a very good definition of what a community health worker does or what they can do, broadly speaking. So I thought it would be worthwhile to go through this for a few moments. And Paula, do folks get access to these slides afterwards?
They do. We'll send them out along with the recording.
Okay, excellent. That way you'll have this handy for future reference. So bear with me as I go ahead and read this one aloud. A community health worker is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. This trusting relationship enables the worker to serve as a liaison or a link or an intermediary between the health and social service systems and the community to facilitate access to services and improve the quality and cultural competency of the service delivery. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. So that's a pretty broad scope of what they can do, and some, depending on how they are hired or who hires them or for what position, they might have a more narrow job description than what this broad capacity reveals. So this definition is actually from the American Public Health Association's Community Health Workers section. So there's a link to that on this slide as well. Next slide, please, Paula. The other overview piece I'd like to mention here is about the roles of the community health worker. And this comes from the C3 project, which is very tiny on that slide there. My apologies. So know that there is not a national scope of practice for community health workers. There is work being done that may lead to that, but it's not there currently. And I have a window open with a truck going by, so bear with me as I shut that window. All right, so there had been a study back in the 90s, a group that had gotten together that gave some ideas of what professional roles were, and then more recently there's this thing called the C3 project, which if you're really interested in some of the more nitty-gritty information about community health workers, you might want to check this out. The 3 C's in this title stand for Community Health Worker Core Consensus Project. Community Health Worker Core Consensus Project. And the idea of this group, a nationwide group, we have Oregon representation in this project, is to get consensus nationally on the main roles, the skills, the competencies that will be required for a community health worker that might form a scope of practice and then a standards of practice and various other things nationally down the road. Bottom line is these are the 10 professional roles that they have come up with. And rather than read these to you, you'll have these for reference, and they actually do reflect the definition that you just heard. A couple of things to mention, though, is that you'll notice when you look at these roles that some of these deal with how you help the individual navigate the systems, like number 3, care coordination, case management, and system navigation. Those are common roles for community health workers working in health systems. And we seem to have a lot more uptake of health organizations hiring community health workers to really focus on that role. But then they also do other, on the community side of things, working with community-based organizations and local public health departments. They might focus a bit more on the community side, say with number 6, building individual and community capacity. They do advocacy with community and empowerment and engagement and all sorts of things where they might do an assessment of what the community's needs are, and then they help work with the community and with other health and social service professionals. And many of you who are on the webinar to help the community take some ownership and of their health and be able to advocate for what their needs are politically and with health systems and social systems, etc. More recently, I'll point out the participation in evaluation and research. So we're starting to have more of that done about community health workers nationwide. I think I'll leave it at that. These first 3 slides were really just a broad overview of community health work. So let me stop at that point and ask if I imagine we may have a variety of people on the webinar, some for whom that was all repetitious and you knew that already, and others for which that information might have been brand new. Want to make sure that we're meeting your needs in this regard. So does anybody have questions or comments or things you want to chat about related to the role of community health workers?
I'm not seeing any right now, but if you guys do have questions, please continue to chat them throughout the presentation. We're happy to address them as they come up.
Okay. Then in the meantime, I'm going to go ahead and move on to a few slides I put together about our program. So the OSU Community Health Worker Training Program started per a request from Eastern Oregon Coordinated Care Organization, EOCCO. Obviously that covers Eastern Oregon counties. I think there are 12 of those counties. So geographically, it's a big chunk of our state. Population, of course, relatively small in that most of the counties are rural, and 3 frontier counties are included there as well. They approached OSU back in sometime in 2015, I believe. This was before I had come on board, and they asked if we would develop a community health worker training program. And in conversation with my boss and others here at the college, they decided on having 3 phases to this program, which I will get to in a moment. Hold on a minute. So let me first start by saying who on our end was involved in this. The OSU is the university. The College of Public Health and Human Sciences is one of the colleges within that university. That's where I work. And we are the primary, the leads on the project, the ones developing the curriculum and doing the trainings. But we're doing this in partnership with 2 other groups on campus. So within the College of Public Health, I work actually for OSU Center for Health Innovation. That's the first bullet you see on the slide there. We obviously are doing this in partnership with our great partners, Paula, through PACE, OSU Professional and Continuing Education. And they help us with many things. They work on many things with this project, including marketing for the program, registration for the students, all of the technology that Paula knows I need all the help I can get with, but all of the, our learning management system and Canvas, putting the courses up on Canvas, etc. So they do great work on this project. They're a great partner. The other partner in this program for us is OSU Extension Services. So 2 of the extension service groups fall under the College of Public Health and Human Sciences. Under might not be the word. They are part of the College of Public Health and Human Sciences. One of those is Family and Community Health. So that's where Jessica works. The other is the 4-H program. Jessica, do you work? I don't know if you work for 4-H as well, but I do know you work with Family and Community Health. So we have a team of folks from OSU who work on this program, and that's what is listed. Next slide, please.
And Anne, we have a couple of questions that are coming in.
Oh, good.
So how are community health workers compensated for the services that they provide?
Okay, so I tell you what, since we have gone into the program, and that's only a couple more slides, why don't I go ahead and finish out, and then we'll come back to those questions, okay?
Perfect, sounds good.
Okay, good. So I was talking about 3 different phases of the program, and here they are. So the first phase is the largest phase, and that was to develop an entry-level course, and that's what we're talking about, what going to be bringing to Tillamook. So community health worker entry-level courses can be offered. They can either be approved by Oregon Health Authority or not. You don't have to be an OHA approved program. Ours is approved, and the advantages of the approval, in addition to that indicating that you have met, that you provide at least 80 hours of programming, that you meet 34 competencies, that you have a means of determining that someone has met those competencies, etc. It also allows those who complete and pass the course to be able to be registered as community health workers through Oregon Health Authority. And if they're registered and they become, quote, certified community health workers, then they or their employers can bill for their services. So they can't bill for services if they don't have the OHA certification. They can bill for Medicaid services if they do. That program the curriculum was approved in December of 2015. We started delivering the first course in spring of 2016, and we provide that course for EOCCO 3 times a year, once in the fall, once in the winter, and once in the spring. Now, that said, we also provide it outside of EOCCO, but that's who we developed this for originally. And so Jessica contacted us and let us know that you have an interest, and so we're thrilled to be able to come to Tillamook as well. It is what they call a hybrid delivery program, in that some of the material is the students access and engage with on their own time, at their own convenience online, and other things they learn and engage with in person. So we have 2 in-person sessions that are full-day sessions during a course, and students also engage with each other via online discussions, and then some of the work they can do at their own pace and on their own time, and they do that online. So that's generally the first phase of the program, and that course is what we're talking about today for Tillamook. But do know that our phase 2 development has to do with continuing education courses. EOCCO referred to these as advanced modules. So these are being launched as we speak. In fact, the first one was launched just Monday of this week, and that's a course called Management of Chronic Health Conditions. The second one is going to be start in November, and it's called Poverty and Related Social Determinants of Health. And the last is Mental and Behavioral Health. And that might be maybe December, more like January, February, probably, when we get that one online. So these can be used as continuing education courses or professional development for people who are already working as CHWs. And then the third phase, we're just going to get started planning on that to deliver in fall of 2018, and that's a Community Health Worker Leadership Certificate. Next.
And Ann, I have a few questions that have come in. So, so the role as described seems very similar to what our case managers do. So are we going to be covering specifically what is in the training that would be beyond what case managers are already trained in and doing? And as a follow-up, what type of agency do they need to be in to bill for Medicaid services?
Got it. Again, hold that thought for just a minute. I think we're going to go to one more slide, and then let's go ahead and do all the questions together.
All right, sounds good.
Okay, good. I think we only have one more slide. Oh, maybe 2 more slides. So here just gives the information about the specific training, the whens and the wheres. Just give you a second to look at that, and then I'm going to go to one more slide, and then we will have wrapped up the slides. Go ahead and switch, Paula. And here I wanted to make sure that you have these resources. So for the Oregon Health Authority, they have their information, their OARs on the traditional health worker, and this will give you all of the information from OHA about them. There's a link to it. Another one is that we have Oregon Community Health Worker Association. It's called ORCHOA. It has a website, and there is the website. And I really wanted to point out, I'm sorry, one thing didn't make it onto this slide, but on that website, there is, right on the front page, there is a video. And I think it's about a 12-minute video. But the point being is, it will go through all of those professional roles that I'd shown on a previous slide, those 10 professional roles. And they do a really nice job of explaining it to give you a really good sense of what community health workers do. So I would recommend that you see it. As soon as you open the page, you'll see it right there, the video. And then lastly, this is the link to our particular program's training. Okay, so that said, that was the quote presentation. Those are the slides, and you'll have access to those later. Now, let's gladly shift on to the chat. Is there a way I can actually see the chat, Paula?
I'm just going to read out the first one, Anne. Sorry, I was just talking to you and my line was muted.
Well, that doesn't help.
So I can send them to you, but I'll start by reading off the first one, which the role described seems similar to what case managers do. So what's covered in the training that's beyond what case managers may already be trained in and doing? And additionally, you talked about the community health workers being reimbursed through Medicaid. So what type of agency do they need to be in to bill for Medicaid services?
Yeah. Okay, so let's start with the first one. It would be helpful for me to know if you could give me a description, if whoever asked that question, maybe if you could get on audio and give a description of what your case manager currently does. And then that might be an easier way for me to respond to that question.
Yeah, and that was from Erin, and Erin, you are unmuted. So if you want to follow up, you're welcome to, or you can chat to me or Anne. Okay. She doesn't have a speaker hooked up, so she's going to call in. So.
Okay. No worries. No worries. We'll go with it. So to answer that then, let me just describe a little bit about what we have in the course or how we go through the course. So our two in-person sessions we do in the first day and about 2/3 of the way through the course. So that first session, we do a lot of introductory information about community health workers, about their history, about definitions, roles, such things as we talked about. We focus a lot on learning in that session. Learning both from their perspective, if it's been a little while since they've been in an educational setting, but more importantly, learning from the perspective of the people they'll be working with, the individuals and the families in particular. So talking about little difference about learning theories, and they practice multiple intelligence tests and those kinds of things. The next session is focused on, and I'm trying to remember exactly how this goes, and that's not a good thing that I don't know this, but I don't. Okay, so another session, they go through physical determinants of health. So they learn about what is health, what is public health, what contributes to health, and they go through and learn information about some of the key, dang it. Okay, they learn information about some of the most common physical ailments that they'll see, about heart disease and cancer, etc. And then we put a fair amount of time on the social determinants of health, which they work with quite a bit, and talk about diversity and disparities, and cultural competence is a big topic that we cover. They spend a fair amount of time on community-based practice, on community outreach, community engagement, community capacity building, and community advocacy. We spend a fair amount of time on interpersonal communication, talking about active listening. Goodness sakes. about motivational interviewing, about individual counseling. We covered quite a few things. Does that give you a sense of what we covered, or do you have some additional?
I think that covered it. We do have one more question that's wondering what kind of information is covered regarding intimate partner and sexual violence, given all the impacts it has on health and social determinants.
Goodness sakes, I'm so sorry. I have to just hang up take that phone off the hook. About intimate partner, well, we do, keeping in mind that this course is an introductory course or an entry-level course for someone working as a community health worker, know that we're covering, ours is an 85-hour program that covers many things on an introductory level that over time can be delved into more deeply. So they do talk about ACEs, we do cover trauma-informed care. We talk about how to engage with people in that regard. Goodness sakes. But then secondly, we have the mental health advanced module or continuing education course that would go a bit more deeply into that.
That sounds great. So what are the requirements that someone needs to get started in the community health worker program?
To get started, the prerequisites or the requirements are simply that you either have a high school diploma or a GED, and that you can communicate in English because we don't provide the training in another language. So those are the prerequisites. That said, we have people that come into the program from a variety of, with a variety of experiences. I'm having this meeting too. This is really distracting and embarrassing. The phone keeps ringing. Somebody really wants to get a hold of me. So we have people that come in who, we've had people that have we've had a doctor from Mexico. We've had people with master's and bachelor's and associate degrees. We've had people that have worked in community health worker roles in the past, but hadn't gone through the formal training and are basically coming into the training for a refresher and to pick up a few pointers and to get certified. So, and then on the other hand, we have people that are maybe have been working in a healthcare facility in an administrative position and are wanting to move into a community health worker position as well. Did that answer that?
Yeah, that does. And Emily was wondering, she didn't hear the answer as to what type of agency you need to work in to get reimbursed for the services. Is there any particular limit to what agency?
Yeah, so my understanding is that it doesn't matter the type of agency per se. The key has to do with Medicaid reimbursement rules. So this really came about with ACA, the Affordable Care Act, that there started to become a vehicle by which you could get reimbursed for community health worker services. Prior to that, you couldn't. So these deal with your Medicaid clients. So any organization that you work for that works with Medicaid clients, you can bill the Medicaid provider for the services that a community health worker provides. Now, I'm sorry to say I don't know the specifics about exactly which parts can be billed. I know with EOCCO, for instance, they have a guide documentation that's available to anyone online. Their guidelines about their utilization of community health workers. They even have some of the coding, the billing coding that they can use for those online. That's something that we could also send you along with the PowerPoint slides after this. I'm going to write that down, Paula, if you'd remind me. We can send you the link to that site, and that might give you some ideas. The other thing is the billing piece is a newer thing for folks here in Oregon. So do know I'm also involved with the EOCCO Community Health Worker Learning Collaborative, which is happening now this fall term. We're meeting with people who are employers of community health workers. We meet every other week for about 8 weeks. And one of the full sessions is going to be about billing, because everyone's still trying to figure out some of the details on that. So hopefully information will be coming out here in the near future on specifics.
Excellent, thank you. Is there a way that qualified professionals can be designated as community health workers without going through the training? The example here is somebody has a master's of ed in, I'm going to mispronounce this, I'm sorry, kinesiology, is a certified fitness instructor, behavior change and weight management coach. But the issue is that they can't have their services billed to Medicaid. So okay. I guess, yeah, if they can become a community health worker even if without going through the training.
Yeah, so the Oregon Health Authority has some specific guidelines about that. Their preferred way of doing this is having people go through a program that they have approved. Another option is that they do reciprocity with people who have had approval from other states, and I believe they have a process by which people can appeal if they've worked as a community health worker for many years. So being called a community health worker because you have other health-related trainings would not work.
Yeah.
Yeah.
Got it.
It all has to do about community health worker training and experience.
And so I also have somebody that was wondering, kind of along the lines, what are if any, are the medical or science competencies of the training program and OHA certification?
Yeah, you know, they're an awareness, an entry-level awareness is what it is. So the key is that community health workers, they can administer community assessments and they can administer individual assessments, but they don't interpret those from any kind of medical perspective. So they're not medical providers. They're not nursing providers. They can provide some services. They can take blood pressure. You know, they can do a few of those things, but that's not their gist. That's not their focus. Their focus is really all about helping to connect these two groups on either side of that bridge, help them understand each other better so that the people in the communities can, say if we're looking at the individuals and the families, that they can have better understanding of what their options are, that they can navigate the health and social service systems, that they can get access to those services, that they can understand what recommendations are being provided or what options are being offered, that they can remove some barriers to be able to access services or to follow through with recommendations. They can help with things like securing transportation to be able to get to appointments, being able to find places in their community where they're able to follow through with the diet recommendations by being able to, you know, access the foods that they need, or the exercise recommendations, being able to come up with systems to help manage the medicines that have been provided by the medication regimes that's been set up for them by the medical community. So they're not medical providers. They are health providers in that way. They are connectors. They are people that really help, you know, keeping people out of emergency rooms, for instance. So does that answer that a bit?
Yeah, that's great. Thank you, Anne. And the last one that we have here, given the various community actually we have two more, sorry. Given the various community nuances, how does the community health worker training take into account which services people should be directed to? Is it driven by local social services and healthcare leaders?
Driven by, So I'm not exactly sure I understand the question fully, but this is what I'll say to that. One of the projects, they do 3 projects during the entry-level training. One of them is to do a county profile, where they really delve into their community, not just their more local community, but into their county to really study and learn about some of the demographic issues, some of the health issues, some of the social issues, and get a better understanding of their community from a population perspective. The other thing is, another project that they do related to this is to develop a resource directory. And in that resource directory, they will be focusing on health providers, clinics, social service providers, school systems, workforce systems, food banks, pulling together the resources that people might need, resources for people who are experiencing domestic violence. And the third project they do is a case study, which is a culminating project that they do at the end of the whole course. The point is, they don't necessarily they find themselves, or with the group of community health workers that they're working with, or the company that they're working with, they find what these resources are, and they are great connectors for this information. But it's not that it's directed by, it's not like someone will tell them, these are the ones that I want you to send people to. They learn about the whole community and give multiple options to people. Does that help?
Yeah, that helps. Looks like it was a very helpful answer. So the role of the community health worker, is that similar? Are you familiar with the program in Benton County, the Health Navigator?
Yeah,
program?
Very much so. Yeah, those are community health workers. They use the term health navigator. Let me back up in terms of terms. If you go to the Oregon Health Authority website, you'll see that they use a term traditional health worker, THW, and they have about 5 different kinds of traditional health workers. One of them is a community health worker. One's a peer navigator. One's a doula. So they have multiple names for these things. And before community health worker was used, other programs came up with other names. So I'm very familiar with the program in Benton County. They have an excellent program. And what they call their peer navigators, those are community health workers. They're the same thing.
Perfect. Thank you, Anne. And we had one more question that came in from, so I know that we've had some people that were asking questions about billing Medicaid, and I also want to point people towards the Oregon Health Authority does have a guidebook on how to bill if you are a provider, and sort of what the requirements are around there and how to get set up. And we can include that link as well when we send this out so that people have that information. If you're just looking at getting started or something like that, it's very helpful and kind of walks you through step by step what you need to do to get set up. And we do have one question from James that says, what experience will you give all Master Public Health students to help facilitate and lead in developing community health worker capacity across the state? It pleases many of us to now see 2 Master Public Health programs and continuing education training for community health workers being developed. So I guess just how do those 2 sort of coexist?
Yeah. Well, to be honest with you, at the moment, there's not all that strong of a connection between the 2 programs. So there's an awareness in Master's program that there are community health workers that exist, and that there are programs, and these are the things that they can do and help. But I'm so glad that you bring that up, because that is part of a conversation that I've been having recently with trying to get some better integration, particularly through internship opportunities and perhaps through some research opportunities. So we're going to be talking next month about the possibility of doing some sort of research regarding the effectiveness of community health workers, and maybe tying some NPH students into the assessment of the evaluation piece of that and the research piece of that. So currently, the bottom line is we've been focusing, when it comes to the community health worker program that we offer, it's been a relatively new program, so we've been focusing on the community health worker end and not tying in PHM, but we hope to in the future. So I'm glad you brought that up. Thank you.
Perfect. And so the last, sorry, we have more. No, this is great. So you guys should keep bringing them in. So do you have materials that someone could take back to their supervisor to make the case for the program, including sort of what are the impacts? I don't know if there's been health savings or if there's any sort of information related to the impact of community health workers.
Yeah, and actually, Paula, I might even refer back to you on that because PACE has put together well, let me back up. I'm looking at the third resource on the screen, the OSU Community Health Worker Training Program. And the point is that they have, on that site, you'll see information for employers. And yes, that information, I think, would suit the need that you're referring to.
Yeah, absolutely. If you go to our website, we do have those, and the next slide will also have my email. So if you want to contact me, I'd be happy to provide those informations in PDF format if anybody has those questions. So people are asking what the training fee or cost is for this, and also how many students you're going to be accepting, Anne?
Sure. So the cost of the program for the entry-level program, Paula?
Is $1,200.
I thought so. Thank you very much. I appreciate that. And in terms of numbers, we accept up to 24 in a class.
Perfect. And if anybody's interested and needs to talk to their organization about getting funding, you can always check in with me throughout the next few months to see sort of what space looks like and how quickly it's filling up. I'd be happy to be a resource for that as well. All right. Oh, and have we considered linking this project in some fashion with the AmeriCorps VISTA program?
No. I'm writing that down, though.
Thank you, James.
AmeriCorps VISTA program. Do you have anything more to share about that idea?
Yeah, James, feel free to keep chatting those, and I can also, if you're hooked up, let me find you in this list. James, are you able to, I don't know if you have audio hooked up.
I'm not sure on the audio, but I'll answer. Can you hear me?
I can.
Well, the Oregon Health Authority has an amazing team of VISTA workers placed around the state working on health issues. And I'm thinking in some ways the OSU College of Public Health and this program would do well and maybe are already linked in some fashion, but I could see that I'm not exactly sure what the nature of that could be, but they're into really development and building systems, and I could see that it could really be useful. In Tillamook County, we've had some amazing VISTA volunteers the last few years, and they have been very, very helpful to the public health process in Tillamook County as we seek to put health in all planning and really strengthen our approach in Oregon. And so I just thought that some kind of linkage with VISTA might be, conversations with VISTA might be worthwhile.
Yeah, thank you so very much. I will look into that. I appreciate it.
Thank you, James. Yeah, and it looks like we have a couple other people that are saying that they have a VISTA that they were interested in getting trained, so we can definitely follow up. And so that $1,200 is for the phase 1, so it's for the entry-level 8-week program with 2 days on site. We did have a question around that. So, all right, so if you guys have more, keep chatting them to us. I'm going to move on to the next slide, which is just information regarding how to register and how to contact PACE for any enrollment questions. So our training, as Ann mentioned, starts on February 21st. These slides will go out to you, and you can register via our website and learn more about the program. So if you go to pace.oregonstate.edu, you can see it all there. This is also linked on this slide as well. And I'm Paula, I'm the program manager, and my email is listed down there. You're welcome to contact me with any questions that you may have following up on this program. And Ann, do you have any final comments that you want to add?
Just to say, I'm so very happy that so many people were interested in coming to the webinar and learning more about community health workers. I know that it is relatively new in the United States and definitely a growing phenomenon. you know, I work in other health related areas as well, and find a special place in my heart for community health workers and the great things that they do. And I think I'm just very thrilled to know that we have such good interest, and would be happy to chat more with any of you. If you have any questions, feel free to contact me as well. I guess you could reach me through Paula if you would like to. So thank you very much, and look forward to coming to Tillamook in February.
All right, thank you everyone so much. We will send out this recording within the next 24 hours, and reach out or give me a call or anything if you guys have questions. Thanks again.